Greetings. My name is Dr. Erica Daniels, and I am an assistant professor of counseling at Evangel University within the online graduate counseling program. I'm a licensed professional school counselor and a nationally certified counselor. In this video, we will discuss the various models of supervision. Let's begin. As we discuss various models of supervision, it is important for us to note the three categories of supervision models. Models grounded in psychotherapy theory, developmental models, and process models. We will spend a bit of time talking about each category of models of supervision in more detail in the next few slides. Here we have supervision models that are grounded in psychotherapy theory: psychodynamic, humanistic relationship, cognitive behavioral, systemic, and constructive. Within psychodynamic models of supervision, they focus on the relationship of the supervisor's authority to the supervisee. The supervisor's focus is the client and the supervisee and the supervisor-supervisee relationship. The supervisor's primary mode of participation is an important part of this model as well. So there's this more triadic approach to providing supervisee that focuses on that hierarchical and evaluative relationship. Within humanistic relationship, the focus here is on the supervisee to expand their knowledge and skill, but also to expand their capacity for self-exploration and the use of self as the change agent. So the supervisor focuses on the supervisee to push them toward developing their skill and their competency level, but also increasing their capacity to explore other ways to support their clients, including how they use themselves as the change agent. Cognitive and behavioral focuses on setting an agenda, homework, and assessment with the supervisee. This is much more prescribed than the other models of this type, as it really puts the onus on the supervisee to establish goals, responsibilities, and tasks that they will work on both in session and outside of session, and which those tasks will be assessed as well by the supervisor. In systemic, the focus is on the idea that the therapist and the supervisors are active change agents in the system they are intervening in. So both the supervisor and the therapist, who is the supervisee, are a part of the same system in which they're looking to affect change within the clients that they are serving, that the supervisee is serving. And then constructive. This is more reliant on that consultative role that we've talked about earlier as it relates to the supervisor, along with the focus on supervisee strengths. What is the supervisee good at? Within the constructive models of supervision, there is narrative focus and solution focus. Um, in narrative, we are assisting the supervisee with editing the client stories and even using that within their own professional stories. In solution focus, there are 7 particular components that are used to address within the supervisory relationship, but also focuses on more small and practical steps for the supervisee and using that also to engage with the clients in which they serve. There are 4 developmental models of supervision that I'd like to discuss with you. The first, from Loganville, Hardy, and Delworth. This model focuses on 3 repetitive stages of development to include the stagnation stage, the confusion stage, and the integration stage. Within these stages, a counselor may be addressing professional issues related to competence, emotional awareness, autonomy, professional identity, respect for individual differences, purpose and direction, personal motivation, or professional ethics. This model presents the stages of development as a cycle that the supervisee would rotate through. The supervisee could be at any particular stage within this model at any given time, addressing any of those professional issues that were listed. IDM, which is the integrative developmental model, focuses on describing counselor development through 4 stages, and each stage describes changes on 3 overriding structures that provide markers in assessing professional growth. Those stages include self-other awareness, motivation, and autonomy. Along within this model, there are specific domains in which the supervisee develops: intervention, skills and competence, assessment techniques, interpersonal assessment, client conceptualization, individual differences, theoretical orientation, treatment plan and goals, and professional ethics. Also within this model, it outlines 3 different levels that a supervisee may be in. Level 1 talks about the supervisees who are generally entry-level students who are high in motivation, yet also high in anxiety and fearful of evaluation. Level 2 supervisees are at a mid-level and experience fluctuating confidence and motivation, often liking their own mood to success with the client. Level 3 supervisees are essentially secure, stable in motivation, have accurate empathy, tempered by objectivity, and use the therapeutic self in intervention. As you would imagine, practicum and internship students are more likely level 1 and engaging or entering into level 2 by the time they complete their graduate studies. SCDS, which is Systemic Cognitive Developmental Model of Supervision by Ragazio, DiGilio, and Anderson. They highlight that the task of the supervisor is to identify primary their primary orientation of the supervisor. The work to assist the supervisee to be flexible and to see the world through their orientations. The 4 orientations are sensory motor, concrete, formal, and dialectic, which are derived from Piagetian terms. In terms of the sensory motor orientation, the goal is to support the supervisee in translating emotional data to a framework for conducting therapy. In the concrete orientation stage, the goal is to help the supervisees see the work and their clients through a linear cause and effect lens. The goal in formal orientation is to lead supervisees to analyze a situation from multiple perspectives and to be reflective. And the dialectic orientation is when supervisees are able to finally challenge their own assumptions, forming their own case conceptualization. So ideally, in this supervision model, they are moving through these particular stages in order to reach the point where they are at that dialectic orientation, where they are able to look at their own information and own assumptions and develop their own case conceptualization independent of the supervisor. The lifespan developmental model by Ronestad and Scoville highlights 6 phases, also referred to as stages of development, as well as 14 themes. The phases are as phase 1, the lay helper phase 2, the beginning student phase 3, the advanced student phase 4, the novice professional, phase 5, the experienced professional, and phase 6, the senior professional. Each of these phases addresses the unique characteristics of that phase that spans from the graduate student level all the way to the experienced professional. And within these phases, 14 themes are represented to characterize the therapist counselor development over time. These themes include professional development being is involved as increasing higher order integration of the professional self and the personal self. The focus of functioning shifts dramatically over time from internal to external, back to internal. Continuous reflection is a prerequisite for optimal learning and professional development at all levels. An intense commitment to learn propels the developmental process, and the cognitive map changes. Beginning practitioners rely on um, external expertise. Seasoned practitioners rely on their internal expertise. Professional development is long and slow, continuous process that can be erratic. Professional development is a lifelong process. Many beginning practitioners, experience anxiety in their professional work, and over time, that anxiety is mastered by most. Clients serve as a major source of influence and serve as primary teachers, and personal life influences professional functioning and development throughout the professional lifespan. Interpersonal sources of influence propel professional development more than impersonal sources of influence. New members of the field view professional elders and graduate training with strong effective reactions. Extensive experience with suffering contributes to heightened recognition, acceptance, and appreciation of human variability. And lastly, for the practitioner, there is a realignment from self as hero to client as heroic within this model of supervision. This category of supervision models include process models. Four are listed here to include the discrimination model by Bernard, the events-based model by Landini, Friedlander, and Nelson, a model by Hawkins and Choate, and then the SAS model by Holloway. The discrimination model by Bernard focuses on three foci for the supervision as well as the supervision roles. The three foci of supervision address intervention, conceptualization, and personalization with three roles that include the teacher, counselor, and consultant. The model itself is situation specific, meaning that the supervisor would take on a specific function and address a particular focal point that meets the supervisor needs in that particular situation. The events-based model focuses on smaller tasks of the counselor's work. Within this model, they highlight three identifiable points in a particular session or markers to include task, environment, and resolution. These points are all addressed by the supervisor who leads the supervisee through a reflective process where the supervisee receives multiple avenues of intervention for those events. Hawkins and Choate highlights 7 possible supervisory experiences that the supervisor can experience. They are called the 7I model of supervision. This double matrix model reflects 2 ways that the supervisors conduct supervision. One is to pay attention to the supervisee-client matrix, and the other is to attend to the supervisee-supervisor matrix. Lastly, the SAS, or the Systems Approach to Supervision by Holloway, includes 7 components. It highlights that a supervisor could be performing one of 5 functions with one of the 5 tasks at any given time. The functions could include advising and instructing, supporting and sharing, consulting, modeling, and monitoring or evaluating. The 5 counseling tasks of counseling skills, rather, are case conceptualization, emotional awareness, professional role, or evaluation. There are 5 other components to include contextual factors like the supervisor, the supervisee, and the client, as well as the institutional context and lastly, the supervision relationship.